3, 2, 1. Nadra Ahmed, OBE, you are the Executive Chairman of the National Care Association. You are also, you've previously been a care home operator yourself, and you hold a number of different exciting advisory roles with a number of other important organisations. So welcome to the Care Home Show.
Thank you. Delighted to be here.
You're very welcome. You're very welcome. So, so tell me, where did it all start for you in the sector?
Well, my background isn't in care at all. I'm a university lecturer by profession, so that's where my background was. But it started with me getting married, and my father-in-law was a doctor and wanted to open a care home, and it was a family that really they weren't very approving of daughters-in-law working.
Okay.
I think Dad kind of thought he'd set this business up and that I would help run it, which was where it started. So they bought they'd already got the building and set it up, and that's where I started. That's why I came into the sector and really learnt what I know now from the bottom up, if you like, from the very, very beginning of starting a 10-bedded service.
Got you. So it was almost by accident then, in which case, because it wasn't specifically by design or anything.
No, but
like that.
I guess in some ways there is this sort of niggle at the back of my head because when I was at school, we used to, in the days when I was at school, we used to do this sort of vocational stuff on a Wednesday afternoon where you could choose to go and support either a school or something, and I chose to go and do shopping for an elderly lady.
Okay.
So down the road we used to have this sort of 84-year-old lady who lived in a flat, and so my kind of last hour on a Wednesday afternoon at secondary school was to go and sit with her, and then I started to actually spend a lot more time with her, and when she wanted to go into London I would accompany her on the train and stuff like that. And so I think perhaps it was always in my DNA.
There was an element of serendipity in there as well.
There was, and teaching wasn't really my preferred choice. It was what my father wanted me to do. He was a teacher, and for him it was a respectable profession. And you had the holidays, so you could bring the children up. That was my dad's sort of theory behind it.
Got you. So okay, and that's really interesting. Thank you for explaining. So. And why is what you do so important to you personally?
Well, I think the sector I work in is probably one of the greatest sectors to be involved in. It really is. It's looking at supporting communities. It's looking at individuals. It's just a massive. There are so many roles you could fulfil in this sector that in itself it's a standalone sector. So you have the care of the vulnerable, which is kind of at the heart of everything we do, and vulnerable is from children all the way up to older people, but it also includes people with disabilities, mental health. So all of those things are part of what we do. But it is that feeling of actually... It's fun to be in because you see the difference in people's lives, the difference you make in people's lives as you go through the day. So when I first started, and I was, it was a whole different world of social care. But people used to come into our services in a very different format because they didn't want to be alone. So you then moved in, you moved along. And now where we are is when I go into care services and I see the way that people are being cared for by a workforce that's under enormous stress 24/7 with an image that is, horrendous. The media have really destroyed the image of social care from being what it really was, which was a pathway to stability and independence, to something that's just, the worst case scenario that you'll end up in a care service. I think that in itself is very saddening. But for me, the fact that people, you know, are committed and dedicated to looking after vulnerable people, there can't be anything better to do.
Mm-hmm. And for you personally, where you're obviously a very passionate person, where does your passion come from for what you do?
Well, I think from the very beginning, I realised that it was something I wanted to do. So I was able to instigate sort of training and education quite early on for my staff. They didn't have training programmes in those days. So, you know, the induction stuff and all of that, I was doing it very early on. But I knew I wanted to do it because I loved the company of the people that were there, the stories they have to tell, the history. So my major was history, so I'm a historian by profession. So I guess in a way I look back and I look at my history around the poor laws and how people were brought into a social care setting, if you like. And not much has changed as to the ethos of where social care is, and it's about looking after people who are not able to look after themselves. But in those days it was more finance based, and it was slightly different. Arguably it's still finance based, but you know, we are looking after people. And so I guess my passion is just the people that I meet along the way. That includes the workforce. You meet the most fabulous people who are working in the sector for all the right reasons. And quite often, early on, there was not a progression pathway. They did it because, A, they liked it, or it fitted in with their, their duties around childcare or family life. And to meet those individuals, and very often they themselves have quite difficult stories behind. So I think it is a sector that is a family. It is a family of social care. And everybody comes in different ways, and they come from different pathways, and they go down different pathways. But actually the ethos is around looking after. And it's not just around looking after vulnerable people, it's also looking after each other.
Yeah,
and I
absolutely.
think that's what you get in a service. When you go to a good care service and you see how the staff are interacting amongst themselves, whatever strata they come from, whether they're senior carers, whatever they are, and the best providers are the providers that you see who are actually engaged with their staff in that way as well. And so that makes the family. So you have the family within a care setting, but there's a wider family of social care. And when I speak to people, in government, whether it's at local level or central government, I get that. So, you know, those that get it actually get it because they can see that sort of familiarity within a sector, because we're all marching towards the same aim, and that is about supporting that vulnerable person who's at the centre, at the heart of everything we do.
It's interesting, isn't it? Because you've got different people who want to achieve the same thing, but with coming from slightly different perspectives, and we'll come on to kind of sewing all of that stuff up together at some point in our conversation, I'm sure. But so you mentioned to me previously that your mum went through the kind of care system, if you like, and then your father's currently undergoing that process at the moment, if you like. Tell me about that for you personally, and then for them, and then maybe a little bit around kind of how those how they've differed.
Well, I think what's interesting is that it doesn't matter how much you know, when it happens to you, you kind of feel bewildered by it all. So I think it did help that I knew about social care and the pathways that we could go down. My mum had Parkinsonian Lewy body dementia, and it crept up, and so it was a very challenging time for us, because she went from being reasonably okay within 2 years to being quite in need of 24-hour care. And to watch that happen as children was really hard anyway, especially the tortured moments that she had. But then also to navigate through what is a culturally difficult challenge, you know, because in the culture that I come from, everybody looks after their own. And the thought that, my brother worked abroad, I had quite a demanding role. My father was is quite elderly, so you know, to look after somebody with that kind of challenge was always going to be difficult. But then on top of that, the ethnicity and finding the right setting for Mum, which would be able to support her, was challenging because we needed to make sure that her cultural needs would be met. And we went into services where they absolutely had no clue, no clue what it meant for all of that. And so I think we are a little bit behind on that, and we will be getting better because now there are specific roles that people fulfil within that cultural field. But I think for us it was a journey that was very difficult, and it remained difficult, and she was there for about 4.5 years in a service who were exemplary in every way that they could be, because they did their utmost. And one of the best things about it was they enabled and allowed their staff who came from the same cultural background to be supporting my mum, but without making any kind of concessions around the criteria that was required around the care plan. And we were very lucky because Mum was somebody who actually was grateful for everything that she received. So she was not a demanding individual. And to the point when Mum passed, it was really interesting because we had our own cultural customs, but some of the carers in that service were from the Philippines. They were, from different faiths, and they actually asked our permission and said, we do this when somebody passes. Is it okay for us to do that with your mum because she was such a lovely lady? And for us, that was really that kind of epitomised the service, that the people felt that. And I go back to my family thing. This is all about one family, and people need to remember that we're a family that would, had entrusted our care there, but actually within that there was this family that was looking after her, and so they were grieving in a different way. And I think sometimes people forget that, and the grief becomes very personal at that point. But
Sure.
You've got to think of it from the other side. My dad's a whole different a different ball game. He wants to be cared for at home, and that's all very well, and it's fine. But his demands are very different. And actually, just the period that's passed, which is about 5 years, I can see the difference in the services, trying to make sure that his cultural needs are being met and that he is being cared for in that sort of confines. So I think it has moved on, and I think it just, for me, it makes me realise just how the impact of having the right people delivering the right service is for a family to feel that kind of comfort, and that's what we've got to do in social care, because it's a privilege to look after somebody at any age. It's a privilege to have children. It's a privilege to have parents at older age, and then it is heartbreaking to watch them going through difficult things. But to enable us to make sure that we do that right, we have to have the right frameworks, the right structures, and we have to get the right messages out to the people to make sure they know what social care is. What is social care, because people have very, very different impressions of what social care delivers.
Yeah, definitely. I mean, you touched on the kind of the media narrative of of social care as a whole, and I think that has a lot to answer for when it comes to the public perception of care. Because I think what I know with my friends who are nothing to do with the sector, they bought into that narrative, and it's a real shame, because largely that isn't the case. Of course, bad things happen, and we need to make sure that as a sector, we do everything we can to make sure that bad things don't happen when they do happen, that they're properly addressed and that there are lessons learned from them. But yeah, I think there's a big void in between what actually goes on and what people think goes on, which is a shame, when so much energy and so much passion goes towards making sure that people are enjoying the best possible life experience wherever they are in their kind of their life's journey. So
yeah.
A big part of what you do, amongst the various different roles that you do, is the chairman position at the National Care Association. So, tell me a little bit about the National Care Association and what does executive chairman position? What does that look like for you?
Well, it's a huge privilege to chair an organisation like National Care Association, you know, I've been part of it since the kind of early 80s, and it is an association that is really there for the people that we support. So that's really important, and that is the SMEs, small to medium-sized businesses, and they are primarily people who own their own business. So this is not about, you know, stakeholders or anything like that. So people have invested their own time, their own energies, and they've grown or not, as the case may be. So we've still got providers who just run one home, and it might just be a 10-bedded home. And then we've got providers who've gone on to buy 30-odd homes. So we are in a, you know, we sort of cover that whole spectrum. We started off as care homes, but we look after people with in-home who run home care services as well, learning disability services, and we're there really to make sure that we're that lifeline if they should ever need it. And so, as an executive chair, I am what I am because I've got a fabulous board. I've got a really, really good board, and they're all providers, very articulate people, very passionate about what they do, and focused on what they do, but also very keen for people to know what they think, and I think that's really important. We're all independent thinkers, so board meetings can be really interesting sometimes, you know, with divergent views. They are a board that are single providers with, you know, 100 beds to some with a couple of homes, which are slightly smaller, nursing homes, people who are specialising in dementia, learning disability services. So we're a board that's quite diverse, and an outward-facing board. We're not all kind of looking at the same things. But of course, then I've got a fabulous team within the office who have grown. You know, we started with 2 members of staff, and it's grown. And actually, we've got a great legacy from the CEO that retired when I took on the role of the exec. And I had been the chairman, so Sheila Scott was our chief exec for many, many years. Very well known, very well respected. So that kind of foundation was always there. So a lot. I learned a lot from Sheila in the way that she was. Absolutely never backing down if she felt that something was the right way to go forward, and I think that always held National in good stead. So we are there for the membership. We provide a complete service. So we have sponsors who support us through legal, insurance, you know, whatever it might be. We have a team of sponsors behind us, and they will give advice to our membership when it's needed, and we can call on any of them to support us through what we do. So I think we've got a good sort of framework around what National Care Association. My role went from being the chairman to being the executive chairman. So as chairman, of course, Sheila did the kind of exec role and the management side of it. I have got management qualifications now as I've come along the path, and I always ran my own businesses, I always ran my own services, so it felt like the right thing to do at the time. At the time there were some challenges for National Care Association, and we made that decision. And I've loved it. It's really good because, of course, the team grew. It's got bigger. It's got better. And strategically, we're in a very strong position now. And so I think it is a family. Again, you know, I go back to that kind of role. Really, it's great. We all know each other really well. This is not just a 9-to-5 job that you go home and you come back, you know. For me anyway, it's 24/7. I'm on call for membership as and when they need. and I undertake that bit of. I do the policy stuff, I do the strategic stuff, I do forward facing on the media, and all of it is stuff that I've kind of really learnt through experience. You don't just kind of start by being really confident to say what you want, because you always think, oh God, am I saying the right thing when you first start? So I think the role is it's a challenging role. It is 24/7, and at times we're abroad, at times we're in England. I'll be travelling up and down the length of the country. We can be in Westminster one minute, we can be, supporting somebody through a really industrial tribunal in another moment. So it is really varied. No 2 days are the same, and you never know what's around the corner.
Tell me what. So what's the NCA looking to achieve for its members? What are its kind of primary focuses, if you will?
Well, I think our primary focus is to have responsible providers. We want people to be able to comply to the law, but within their own parameters, because everybody has got their own business plans, their own business roles. So we're there to support them through the challenges of local authority fees, if you like, and we can support them through that. Keeping up to date with legislation, whether it's health and safety, whether it's safeguarding, supporting them through cases that maybe, CQC is a huge subject that comes into, and we have a compliance director who deals with that primarily. So we're there to be that extra bit of help for them, that little, because very often providers will ring us with an absolute frenzy of questions, but if we talk them through it, they've already answered their own questions. So it is about checking. It's just about checking with somebody else. And very often they'll say, oh, thank God I've spoken to you, because I thought I was going mad. I thought this was wrong or this was right. So our role is to support our providers to be responsible providers. And we do that through a number of, publications, through the support. We do regional events across the country. We do a biannual conference where we have the great and the good, leaders in. We're very, very fortunate, because when we do the regional events, we have people from the Home Office, we'll get people from department, we'll get people from local authorities, we'll get this national solicitors. Everybody will come along and support us through, whether it's immigration law, whether it's a tribunal, whether it's digital, which is now the big thing. So one of my vice chairmen is very strong on that subject, and so we try and cover everything that will be needed for them going forward. And I think that's what NCA is there. It's that sort of insurance for you, to make sure you can either check in with us and see that you're doing the right thing, watch the paperwork that comes through, the emails that are coming through that are telling you about, dare I say it, Brexit, whatever it might be, so that they're prepared for that future, and it's making them future proof. And if they get to the stage where they can't do that anymore, then we try and support them through an exit plan as well.
That makes sense. And I guess the life of an operator can be quite lonely if you end up being quite insular and not having an opportunity to be able to take influences from outside. It can be very easy to get sucked into the day-to-day operations and things like that. So to be able to have a community of people, other operators, and within the NCA itself, to be able to pick up the phone and just say, I've got this problem and it looks like this. And it's interesting what you said about talking through problems. We get this quite a lot as well. When you get presented, you almost get information overload. We all get it sometimes, don't we? And just having a friendly ear just to talk something through, sometimes you can get to the answer, as you say yourself, but having someone that that you can soundboard an important topic of conversation with, it's just immensely useful just to be able to, as you say, just to pick up the phone and just say, how do I go about fixing this?
And
weird and wonderful set of circumstances.
It's giving them the confidence to know that what they're thinking is the right pathway. I mean, what really worries me sometimes is that we'll get providers who'll ring us up and say, I've just been told this by so-and-so that I've got to do this. And I think to myself, well, you're the professional. You know, you are the professional. If you've made a decision around something, you must be absolutely clear why you've made that decision in the best interest of the individual that you're caring for.
Of course.
And if you can then document that and audit trail that and show why you're doing that, I'm not sure why somebody would tell you to do it differently. And I think sometimes that kind of confidence building, if you like, makes them think, actually, she's right. You know, I'm doing this not because it's easy for my staff or because it's going to cost me less. I'm doing this is because I need to do this because that's what the individual wants. So we talk about personalisation as a sector. We talk about all of it. And then what we try and do is we try and put people in boxes and say they must do it this way, they must do it that way. You as a, you know, why? If we're talking about personalisation, if somebody decides to do something, and you can show that you have safeguarded it and you've done all the risk assessments and you've checked it through and you've made sure that you're doing that, then what you must be able to do is show that.
Of course.
And show that it's got the person's best interest at heart, and this is what the person wants and the families are involved or whatever it is. So I think that's what we try and do, you know. However, if somebody's not doing something right and they've said something to me and I think, oh, why are you doing that? Then, you know, we will tell them why we think that might not be the right way to go forward, and hope that they will take that advice. And very often people do, and say, well, I hadn't thought of that, or I, you know, actually, yeah, no, I didn't do that, or whatever the case may be. So it is, I mean, talking with family when you're in situations, very often that is what happens, isn't it? You do come to that. You come to a consensus, and that's what it's about. And if you never ever forget that it's in the best interest of the people that you're caring for, you will always come round to the right decisions.
They say doing the right thing is always doing the right thing, isn't it?
Absolutely.
So
and the right thing for one is not always the right thing for another. So that's why personalisation is something that we've been doing since the 80s. You know, I get very irritated about it. You know, it isn't a new buzzword. We were doing it in the 80s.
It's interesting, isn't it, how some people would almost class that as being like a positive style of risk-taking, because it might be deemed because it doesn't sit in one of those cookie-cutter box type things. And again, it comes back to the fact that doing the right thing is always doing the right thing. If that's what that person needs, wants, desires, for them to be experiencing the best possible life, then that's what needs to be done. And yes, some work might need to be kind of wrapped around that to make sure that it's done in the right way. But yeah, it comes back to just making sure that the person's being properly looked after.
I think that's, I mean, you know, if I use a personal example with my dad at the moment, you know, the biggest risk we have is medication. He forgets to take his medication, but he's very able-bodied, and he wants to go, he catches the bus into town, you know, and he's in his 90s. And that's what he wants to do. So both my brother and I have had to do some real soul searching, which is quite challenging because of the circumstances. But we have said to the carers that have been coming in, you know, as long as we get the medication sorted out, if he wants to go into town,
has to be his choice.
You know, if anything happens, it happens. It's choices that people make, you know. When my daughter decided to go backpacking across, you know, all the different countries she goes backpacking, I had to kind of reconcile myself to the fact that the risk she was taking was a risk she was taking in the knowledge, full knowledge that that's what she wanted to do. And you just have to take a deep breath and go with it. But as long as we are clear what the risks are, why somebody is doing something, and that is helping them maintain their independence, whatever that reason might be, we must be able to let people do that. That is what personalisation is.
Yeah, definitely, without a shadow of a doubt. That's really interesting, thank you. A slight change of gear. Tell me your view on the sector's working relationship with the NHS.
It's an interesting one, isn't it?
Could do a podcast on this subject alone.
You could do that, yeah. I could spend quite a bit of time on this one. I think there has always been a push towards this, you know, that we've got to work together, and an element of that is true. However, they're two very different services. One looks after acute medical needs, and the other looks after social needs, arguably. and that I'll come to that in a moment. But what concerns me is that whatever we talk about integration, social care never comes out well at the end of it, because it's integration that is led by the NHS.
Mm-hmm.
And I guess I have a real fear around that, because we never come off. So when parcels of money are sent across to social care,
Mm-hmm.
it comes through a pathway of somewhere else. It's either the NHS or the local authority. It's never social care.
Mm-hmm.
It's not ring-fenced. And so those improvements happen within the NHS, or they happen within local authority, and touch the fringes of social care.
Mm.
But social care remains that poor relation, if you like. And so I then start to think about that and think, well, at what point is this integration? Because it's not an integration of equal partners. It's an integration that is led by somebody else towards an outcome, which very often is not discussed with the sector. So I think there is a real challenge. So for me, social care is an absolutely standalone function. It is something, a sector that should be standalone, be treated with respect to standalone, because what we do saves the NHS a huge amount of money.
Immense, yeah.
Right. And it supports the local authorities in their outcome-based functions. So I think we have a real challenge when people talk about integration being the answer to everything. I think there are elements within the NHS which I cannot understand why they haven't come together, and that is about workforce and training and education. Why would we not be looking at a methodology whereby training and education of our workforces, whether it be social care or NHS, would be the same? Because we're looking after the same type of people. So when Mrs. Smith comes out of hospital with all her acute care needs met, and she's had a hip operation or whatever, she comes out into a social care sector which then looks after her in the framework to promote independence and all of that. So we do the same kinds of risk assessments, we do all the same sorts of things, and yet so our staff are doing the same sorts of things. And actually, in a hospital setting, a nurse gives out the drugs. In a care setting, senior care staff are trained to give. So when you look at skills bases and everything, my staff, my personal staff, but the social care staff are much better in the delivery of skilled work, and they're not qualified to the same levels. So I think when we talk about integration, I think that workforce equalisation needs to happen. We need to get that together. I think the other functions are very difficult because, of course, social care has many masters.
Of course.
So every provider is an entrepreneur in their own right, or they have their own boards or whatever it is. NHS has one master. So how do you bring all of that together in order to deliver what true integration might mean? So I think there are elements of it which need to be, and some of it needs to be led by social care. And I think until and unless politicians at all levels recognise that not all innovation and funding for innovation has to sit with the NHS or the local authority, it can sit with social care. Until they look at that as being a way forward, we're never going to really equalise that partnership, and yet we're the ones delivering what is now healthcare needs.
Largely, yeah.
And so I think we need to redefine what social care does. We need to actually seriously look at what we're doing. We're not looking after the cream tea society. When I came into the sector, people used to walk into my service or drive into my care home and demand a bed. We want to be in your care home. It helped that it was a large country manor house, and it was known in the village and all of that. So they thought that this is where they wanted to spend the rest of their time. What's now, so what's now happened is somehow we have shifted that to where Joe Public is told it's the last place you need to go to is a care home. We'll try everything else. You don't need to go to a care home. So why has it changed so much? So what we now find is, that the people who used to come to my service are now going into sheltered accommodation, all of that kind of stuff. But actually, we are now looking after people who are in long-stay geriatric wards. So we're looking after people who are being discharged out of hospital with healthcare needs into our services, but actually we're not being funded for that because the funding has stayed with the NHS. It's never come back out to social care,
which is amazing. Not amazing, but from my understanding, and you'll know this far better than I, there's enough money within the system to correctly fund it, as I understand it, and it's a case of how that funding is correctly allocated. But even at a more reasonable funding amount, say for somebody living in a care home, let's say maybe 25, 50, maybe even 100% more, depending on the needs of the individual, that could be easily funded by the NHS and would ultimately save the NHS vast amounts of money, depending on exactly the set of circumstances. But we still haven't quite managed to bolt that together in a way that works for everyone.
And there are pockets of money around the discharge, funding that was put out to alleviate the problem of delayed discharge. But when you look at it and you think about Mrs. Smith, who's my favourite character in the world, Mrs. Smith, who's been has been in hospital and is being discharged, and in hospital a week has cost over £2,000, £2,125, I think it is, for a week a bed in a hospital. But we actually think it's okay to discharge Mrs. Smith into the care of Happy Valley and pay £500. We think that's okay. So even if you take out the medical costs, the hospitals, all of the care is the same.
Exactly.
So how can there be such a variance? And if there was just a slight shift in the package of care following the person, I'm not saying, I'm sure some providers would say they would be delighted, but I'm not saying that pay everybody 2,100, whatever it is, to come into a care home, but pay a portion of that. Let's be realistic about what it costs. And some people will say 700 is a realistic fee, or 900 is a realistic fee. And if you're in one of the settings, 1,400 is, whatever that fee might be, it is less than
whatever's going on in the NHS.
Yes. So absolutely. And there's a personalised service. It's in, somebody in their own room, somebody who's really, getting 24-hour care with all sorts of therapies, visits, outside, inside, hairdressing, all of that going on. And that's what's going on in a care service. So I think until we kind of start talking about the reality of what social care delivers and politicians actually start to understand it, because I honestly think a lot of politicians don't understand what social care is.
I agree with you, yeah.
And if they do, then they're closing their eyes to it. There are very few politicians that you talk to who actually get it. And I think that's quite scary when you've got 600 odd in the chambers.
It'll be really interesting to see if you were to ask politicians pre and post finding their elderly loved ones or loved ones who are in some type of vulnerable set of circumstances where they have some needs, to go and work out kind of what impact that might have on their kind of the decision making and how cognizant they are of the situation. Because to your point earlier, until you've experienced care, and even in your circumstances where you knew about the sector and things like that, it's a minefield. It's incredibly difficult, and it's not to mention the fact that it's woefully underfunded, but a lot of it just doesn't quite make sense. And there's a lot of people trying. I think there are a lot of operators trying to work hard to try and make it easier, but there seems to be a distinct lack of joined up thinking.
Yeah, I mean, I think there are perceptions. You see, people think, well, I didn't know how to pay for that. I didn't know how to do that. I didn't, So there are all sorts of, the plethora of kind of questions is substantial. But also, I think the vision that's been created is a 5-star hotel. And there are some that are delivering that, which is fine. so people have that perception, but how many people want that? How many people can afford that? That's the question that sometimes needs to be asked. But what I think is important is that people, you say about I've had two politicians ring me when they needed care, asking me what they should do. I've had journalists ring me and say, God, I knew I needed to ask you because I've just been told this. My sister's trying to sort this out and this. And you kind of think, even when you know, you just have to second guess it a little bit. And I knew a lot more than some people, but I was kind of learning on the way, filling in attendance allowance forms, what benefits can we, how do we sort this out with the house being, all of those sorts of things. There's a lot of questions. So somebody, going back to something you said earlier about your friends, somebody who's never been touched by social care, well, why would they need to know? You only know about social care when you're impacted by it. And it only matters when it matters. So I think the education bit about what social care is needs to start much younger. I do think people, my exposure to the lady that I looked after was when I was 16, so I knew a little bit, not as much as, what was going on at that time. But I think we have got to start, my grandchildren know more about social care because they're exposed to my dad. They saw my mum when she was poorly, all that kind of stuff. So they know that people get older and they have to be looked after. And a lot more generations, we're having that. As people are living longer, you're beginning to see it much more. And I think there are some families, people don't, it's very hard to have an older person living with you with all the needs that go with that. So if we are going to look at that social care sector, which has got to grow and the demand will grow, we've got to make sure that people are understanding of, comfortable with, what goes on in a care setting. So when we hear about that very small minority that which is wrong and actually should be eradicated, absolutely, that atrocious things happen in services, we really need to resolve that, because that is a portion of people who we have a regulator to regulate against. And if we didn't have the recruitment crisis that we have currently, we would be looking at a really good stock of staffing going on, good training and education, and people putting funds into investing in people within their setting, and we would eradicate it. So I think there are some real things that need to be done in order for us to kind of move that forward.
I agree. We're kind of talking about the let's say the consumer end of the spectrum from the perspective of the kind of political world. Are you expecting a green paper anytime soon?
Oh, absolutely. Any minute now. I think
of course.
If I check my phone now, it'll be there. Sadly, no, not at this stage. And I think the green paper that we all worked so hard to kind of make sure it was what it was with the current minister, even if it did appear now, it would have to be
amended and kind of brought up to date.
It would have to be brought up to date. And actually, what would it bring out? I think that's what we need to challenge here, because we need to understand what the green paper might have said, because we've had a number of commissions over the, and I always think to myself, when these consultations happen, I'll just take off the shelf the one that I did for 10 years ago and see if it's made any difference. And actually the same sorts of things are said, and that is around the funding of social care. And then what happens is they say, yes, we recognise that there's a funding issue, but actually we haven't got the money to do it. So let's, so Andrew Dilnot's piece of work was a really very thorough piece of work. And it needed to, if it's not the right, it was a starting of a conversation. And we need to start the conversation. Damien Green's bit of, about insurance, all of that kind of stuff. We need to start the conversation. We can't just keep shelving it. So something's got to come out that looks at, that has a realistic approach to what social care needs to look look like for the future? And that isn't all the bells and whistles and gold taps and sea view. It's about the care. It's about the care, you know. And unless we refocus on just making sure that we are absolutely committed to the levels of service that we provide, and we're not, you know, if somebody's got cracked paintwork, you know, should we be saying they require improvement? But they might have the best and the happiest residents in the service, you know. So I just think we need to remotivate ourselves as to how we're measuring it.
You've obviously been involved in the sector for a number of years. How have you seen things change since you took that role on as working in the care home?
Well, I think the shift from that cream tea society, you know, when we used to take our residents to the seaside, and I know lots of people still do, but they were all, you know, walking in and walking out of our services. The people we're now caring for have acute healthcare needs, and they're complex healthcare needs. So the oldest residents we used to have were in their 70s. You know, we're now looking after people who are knocking on the 90s and the 100s. So I think the shift in the level of care that we're delivering is fundamentally the main focus if I look at the changes. Also the staff, I think, you know, we're looking at a workforce that has much higher skill levels requirements. You know, they need to know a lot more. We're the most legislated of all sectors. You know, it's the amount of legislation that we can have. I remember at times thinking, my God, if the environmental health person came, they could close me down. If, you know, so you live under this kind of cosh, if you like, of always having to move forward. I didn't have a secretary. You know, I don't know any homes around who don't now have secretaries and administrators or whatever, you know, to just keep in tune with the paperwork. You know, so we've got this so much paperwork now, keeping everything up to date, doing, you know, and some of that is really, really good. Some of it's really good. The other thing I think that is very noticeable for me is the interaction with general practitioners. You know, we used to be able to have those conversations. They'd come into the care home, you know, district nurses coming in. There was a much more of a community feel around it. Now I think that has kind of disappeared, and that's a bit difficult. We could pick the phone up and say to the local GP, Mrs. X is just having an asthma attack, I think. So, you know, and they'd say, right, let's get that sorted. And it was much quicker. And that function was much quicker. So we didn't have this revolving door to NHS.
Sure. What do you think that's derived from? Like, where do you think that change has come from?
Well, I think everybody's managing their own budgets, and I think, you know, the first time I remember a doctor saying, "Do you know how much I get paid for every person that I look after?" And I said, "Well, I thought you'd taken the Hippocratic Oath, not the Hippocratic Oath." You know, it was just one of those really ridiculous things about what you earn for each patient on your and I think that's what worries me, that everybody's managing their own budgets, and so what do they give up in order to save themselves time?
That makes sense.
I think that for me is a real challenge, and that we've moved away from that, you know, the whole sector approach. The health and social care, although we now have a health and social care department, we almost have, we've kind of broken it up, so it needs to be put back together, because it used to be a full care package when somebody came into a care service. You know, we'd get the physios coming in, we'd get the district nurses coming in, all of that, and now that's really hard to do.
Oh, definitely. What do you think we're doing well at a sector, and where do you think that we need to improve the most?
Well, I think what we're doing really well is that we are looking after people with quite complex healthcare needs, and we're doing it well. The vast, you know, when you say 84% of all care services are either good or outstanding. Well, that's
fantastic stuff, isn't it?
Great.
You'd like it to be more, of course,
yeah,
but it's still pretty good.
I'd like but some of those required improvements may be very small required improvements. Some will be devastatingly bad. And, you know, I know the variation, and there's a whole debate to be had, which you could have a whole programme on, about whether CQC ratings work or not. But if, with what we have, that's pretty good. But then on the back of that, you've got that workforce issue of, you know, 110,000 vacancies. Mm-hmm. So I think we've really made massive strides forwards in the type of people we're now looking after, who really are healthcare patients. But we're bringing them into our own homes, and we're trying to create that environment, and we're meeting all their needs. And I think where it's done well, it's being done really, really well. And I think we should be so proud of that.
Definitely.
But also proud of the workforce that's actually delivering it, because they're the people who are making it happen. You know, none of us could do anything without that sort of support. And when I hear about the stories around, you know, care staff who are coming in their own time to take somebody shopping and all of that, I think that's what our sector's all about. So we do it really, really well. I do think we need to improve on a more united, a combined message around the strategic workforce, the strategic pay issues. You know, how much are we getting paid to deliver that service, and have that really open debate with the NHS and with officials and the you know, local authorities on an equal footing about what the reality is and where the gap is. And you know, when I hear about, we've got members in the Midlands who tell us they get £484 for somebody with dementia. That's
it's terrifying, isn't it?
Ludicrous.
Oh yeah, absolutely.
Absolutely ludicrous.
Is that in Birmingham through the the technology system, almost a bidding system?
Yeah.
I was somebody called it eBay for older people or something like that, and I mean it is almost as bad as that, isn't it?
It's just atrocious. And why isn't government stopping that from happening? You know, I just don't understand that. Why would you even do that? You know, we talk about dignity of individuals and all of that stuff, and then you do that, and if I saw that on a portal with my dad's face on it, I'd be livid. I'd be absolutely livid. And I think this reverse kind of, you know, incentive to get the lowest, I think local authorities should be ashamed of themselves. They should really be ashamed of themselves when they go through the tendering process, when they know individually that actually it's going to cost more to a provider. So we're expecting providers to continue to subsidise the state. Consistently, we're up, you know, the providers in social care are subsidising the state because they're not being funded. And if you were looking at a funding, you know, everyone has different models. They may have mortgages to pay that are different, or the borrowings might be different. But if you were looking at even £700 a week, it doesn't touch the edges of somebody being able to then reinvest, innovate. You know, all these buzzwords, everybody wants to do that. You know, but if they're getting, you know, between £400 and, you know, £700, that
doesn't leave an awful lot. It
doesn't leave a lot of room. And then I get really irritated about people talking about providers having, you know, holidays. And what do you expect? This is a person's investment. They have a right to take something out of that investment.
Of course, yeah.
You know, everybody else who works in government and all of that, they have their holidays, and why is it that it's so awful for providers to be able to, you know, take something out of a business? Surely that's what should be happening to encourage good business in the sector.
Yeah, I guess the fear is that people are going to be greedy, and it's. I speak to so many different operators, and I just don't see that. Don't get me wrong. I see. I do see it sometimes, but I don't think. Again, it's a perception thing largely. I think a lot of people think that it's you've got these money grabbing operators and things like that, and it's like, well, yeah, you need to run a business, and you need to run a business sustainably, and that means making a profit, and that profit largely is going to be reinvested into the people and the fabric and the structure, and as you say, the innovation and things like that. But if you want the highest quality of care, then that needs to happen. It can't happen both ways. You can't have an unsustainable business model and then expect the highest standard of care, because those two things just aren't. It doesn't work.
It doesn't, and the viability of a business is something that bank managers want to see, and you know, all of that. So they want to see that that somebody is doing something well and being successful and looking at and being responsible employers and all of that. So all of that does come into a package of care. And then ultimately, if a provider is getting sufficient funding and is able to pay their staff the right wages, the impact on the individual that's being looked after is a safe environment, but one that's a sustainable environment that's not going around the corner and seeing home closures and worrying about what you're going to do next. And then there's the outcry around, if you move people at this age, they're all going to die. Well, if a person cannot pay, if the provider cannot pay their creditors, how are they going to carry on subsidising the state? That's the problem.
One of do you know a chap called Adam Hutchison?
Yes, I do. Yeah.
You do. So yeah, a good friend of mine. He's done a couple of episodes with us, but one of the episodes we did was largely around the postcode lottery, around funding for care homes, and he had a gentleman that lived with him where I think the local authority was going to pull the funding to some extent. They were basically going to decrease the fee that they were providing for somebody living with reasonably complex dementia, and there was absolutely no appreciation of the fact that if the gentleman had chosen where he would have lived, it would have been in Adam's home. There's no consideration around that at all. They just, I don't know exactly what the current set of circumstances is, but they were threatening, they were posturing to basically say, we're going to have to take this person out of your home if you're not willing to accept our fee of something absolutely pathetic. And I just remember thinking to myself, it's so sad, because there's no consideration around the person. It's just around the pound, shillings and pence.
And I think that's where we go back to that sort of term personalisation. There's a choice and control and all of that kind of stuff. And I used to be the trustee of a charity where we had learning disability services. And I always remember this sort of, getting people into independent living and all of that, which was fine. It works when it works. But what people forget, the consideration, is that people are sustainably well when they're in an environment, especially in learning disabilities, where they have regular medication, regular meals, they're supported, all of that. That brings them to the level of independence, so that when they're assessed, people think, well, they don't need to be in here. What people forget is that the minute you take them out of that setting and they have to rely on it themselves with that nominal support, there's a downward. And I always remember the case of a couple of young girls who'd gone out of our service because of this very reason, that they felt they could live independently. They'd gone down to the local pub and been chatted up, and then given somebody their address, and at about midnight our service was getting calls because there were two drunken lads at the bottom of the door, banging. Right, so you have to take all the components into the equation when we look at that. These are the cost-cutting measures must not compromise the stability and the safety of the individual. And I think that's where we go wrong in this sector with local authorities when they're looking at their funding, and central government when they're looking at what they're giving local authorities for that sort of level of care.
So what would you most like to see change in the future?
I think I'd like to see social care becoming a power in its own right, rather than being kind of muted as something that needs to be part of the NHS or part of anything else. I think I'd like to see social care providers much more confident in the service that they deliver, because actually what they deliver is really very, very good. I think the workforce issue, I would like to see it resolved. I'd like to see a lot more commitment towards that. I'd like to see a training and education programme that is consistent with the NHS at the same level, so that we are not we're not looking at losing people to the NHS as well, because that's what tends to happen. People get experience in social care and then they'll move to somewhere where they're going to get better pay for whatever reason. So I think we need to be a standalone service which is recognised for what it does, and for the commitment of the people who are working in it. And they're all entrepreneurs who work in it, and they're committed and dedicated. I see some of our members who've been doing the job for 40 odd years now telling me that they just want to retire because actually there's no recognition for them that they have done what they've done and they've done it well. All they ever get is the pressure, and for CQC inspectors coming around and trying to find fault. I think all of that has got to change. All of those the components about respect for our sector, respect for the individuals who work in that sector, the element that is bad, let's eradicate it, let's talk about that. And I don't think any responsible provider would ever say, no, this home down the road should stay open even if it's, not feeding people properly or whatever the case may be. So I think for me there is that the status of social care needs to rise. We've had those moves. We've had the moves around, Department of Health and Social Care, but we've got a Secretary of State who doesn't actually do anything much within social care. I'd like to see him to roll up his sleeves and come around a care home, tuck his tie in like he does when he goes to hospitals, and come and talk to our residents and be filmed doing that rather than hospitals. And the Prime Minister, they all have these fabulous statements to make on the steps of 10 Downing Street. Lovely. But actually let's walk the walk. Let's just see what you can do and come and talk to social care, come and talk to the people delivering that service. Not just the big grandosies who hold stakes in the sector, but actually to the people who are delivering that service. Come and have a look at that. And I think, and I have the privilege of being a trustee of a very large charity that delivers social care, and we have a community. And we have a lot of politicians come to that service for various reasons, and they're eye openers for them. And they, it is nice to see the politicians come, but I think I'd like to see some action now.
It's been a long time coming.
It's a long time coming. Maybe before I go.
Well, let's hope it's before that. Fingers crossed, at least. Anyway, how? Again, slight change of gear, but within a care setting, how important would you say that culture is?
Well, I think it's really important. I mean, culture is the baseline of anything, and if you're running a household, it's what you make that a household. If it's going to be a happy household or not a happy household. So the culture, and that goes to leadership. That is about having the right leaders leading the field. So I think that in itself it is been a great deal of emphasis on that. And I think when you're culture embraces ethnic minority groups, that sort of so it's within a setting you can have lots of different cultures as well, but it's that culture around delivery of good care that has to come from the leadership. And actually that's part about listening to people who are working within the service. If there are things that can be done, the number of times I've had members of my staff say, why don't we do this? And I think, well, that's a great idea, let's do it. Make people part of it, because we don't, as leaders in an organisation, you don't have all the good ideas in your head. You've got people who are actually working for you who will have better ideas. And it's embracing that and then acknowledging it that makes all the difference. For the carer that wanted to bring, an Asian curry for my mum into the service and getting the permission from us, who made a huge difference to my mother's life at that moment in time, which is something that the leadership at that time hadn't thought of. It's all of those things. It's about making sure that we are delivering that personalised service, and the culture should enable you to embrace all of that. And if we can do that, then actually you've got a winning service.
Yeah.
And leadership is crucial in all of that, to make people realise, there are leaders who walk in with their suits into a service, and that's great. I used to say to my board at the Learning Disability Service, when you come to the Learning Disability Service, please don't wear suits. Don't wear a suit. And initially they were a bit shocked by it, but actually that makes a difference.
I've had to do it on a couple of occasions, and almost every time it's happened, I'm just trying to think now. So probably 4 or 5 times in total, and it's because I've been doing other things at other times and things, and I just refuse to do it now because I think 3 of the 4 or 5 times, the fear of God is instilled into the team, because they think that you're either the CQC and they weren't expecting you to turn up, or somebody. There's a negative connotation around kind of people turning up in a suit, which you don't want to inflict that upon anyone. So it's interesting.
Yeah, I think it's being culturally competent as a leader is, embraces not only the culture within the home, but the culture of the people that you're caring for. And they will have different cultural needs. If they come from Wales, or they come, it's whatever country they come from, and we're looking after more and more people from ethnic minorities. How do you actually embrace that and make it part of the culture of the service? Rather than stand alone, And I always remember a really poor example going into a service where it was, I think it was Diwali, and the 2 residents in the service were sort of in a little area celebrating Diwali with all the things, the food and all that.
Right. Yeah.
Why not make it the whole?
Yeah, it's a party. It's an opportunity to celebrate. Get everyone involved.
Yeah. There are missed opportunities, but I think that culture has changed in that it is a bit more. I mean, I understand why some of that happens, because when I first started running a care home, I remember we had a gentleman from the British Army who'd obviously fought in India. It was a time where we had really bad snow, I don't know, it might have been this big storm or whatever. Anyway, the food was short supply. So I made the executive decision of saying to my staff, well, if we run, with bread, use the door stops, use the ends. So don't throw anything away now, let's just do that, and we'll bake our own bread and all of that kind of stuff. And he was given the end of and he threw it across the table at one of my staff. And I sort of went and said to him, don't do that. This is not appropriate. And they were complimenters at that time, the residents. And he just looked at me and he said, how dare you speak to me like that? He said, people like you used to polish my shoes when I was in India. And I just remember thinking,
wow,
how do I respond to that? But it is that sort of level, isn't it? So you've got that going on. And I just remember saying to him, we all live in the same house now, though, don't we? So we're all in the same rules. So and he just sort of immediately was taken aback. He thought I was going to be really cross with him, and I just sat down with him and started talking to him. And then he, we came round to him saying what good English I spoke, and we were all good friends. But he was very angry, and so his retort was that. And I think that has changed a little bit culturally, although it still probably happens in certain services, I don't know, where there aren't many people from ethnic minorities, but we are going to have to start to look at that a bit more.
What was interesting about what you said then was the fact that you actually came to quite a positive outcome just by having a conversation. It's amazing how many things can be resolved with a effective discourse. But what you mentioned leadership in your response a couple of times there. What are your biggest leadership lessons?
I think it's inclusivity. It's about actually not thinking you're the leader. And that's not moving away from decision making. I think that's the challenge, isn't it, when you kind of look at it. But I don't think I think with leadership, for me, it's always that leaders don't all have all the answers, because if we did, then there'd be an elite out there who did everything. And I think that everybody makes mistakes, and it's about recognising mistakes, but leadership is by example. So I think you've got to be doing rolling up your sleeves and doing stuff. And I always remember a director of social services saying to me many years ago, when I used to have regular arguments with them about funding and fees and that, saying, right, okay, then we'll go into a hospital and do a shift. So and then we'll go into a hospital, into a care home and do a shift. And we did, and nobody knew who we were when we went in. And I think that showed both of us, so we could talk to our staff in a different way. We could talk about it in a different way. So I think it is about that. It is about being able to understand what makes your service tick. So if there's something not happened in the laundry, that's a major issue for your residents, and so what, taking your eye off the ball there, but then actually accepting that the people who make those things happen are as equally as important as those sitting in an office. So I think it is about that inclusivity. I'm sure there are much more clever answers around what leadership means, but for me it is about inclusivity, and it's about never thinking that you're in a different space to everybody else. It's about being in the same space as everyone. I
think that's really important. I think that's a great answer. So thank you. If you were to give one piece of advice to somebody looking to make a positive impact on the care sector, what would that piece of advice be?
I think it's about doing your homework.
Okay.
And actually understanding what social care is, and not being hit by any surprises, because I think sometimes people come into the sector with a vision, and sometimes that vision is quite easily dispelled because they've and not done their homework. I think it's a great sector. It's a great sector to be in. Make sure that you have all the knowledge that so that's understanding the legislation. I always say to managers in care homes that if I walk into a care home and I see the regulations on your desk, I know that you're a manager that actually understands the regulation.
Gets it, yeah.
But if it's on a nice shelf up there, which you refer to periodically, the more you thumb through it, if an inspector says to you, under regulation X, Y, Z, how would you then respond to it? You should be able to do that. You should be able to do that. So that's a really important bit of working in the sector, is to know the framework under which you have to work. But then outside of the framework it's about the service that you want to deliver. So if you want to deliver the gold taps and sea view, then look at why you're doing that, and the area that you're looking at. If you want to deliver the service that is the regular service, then understand that as well. I'm struck by something somebody said to me at a conference I spoke at, and said, actually, and it was for service users, I just want to be in a home that I feel like I'm at home. And basically they were not. It was. I followed somebody who was talking about new architects who were talking about new builds and stuff. He said, well, if I want to go to the cinema, I want to go out. He said, I don't. Why wouldn't I want to go out? And that was a different kind of service that he was looking for. So I think there are different things that we need to. So just make sure that whatever it is that you're thinking you want to deliver encompasses the service user that you are wanting to bring into your service. So I think doing your homework, understanding the people that you want to be delivering the care to. So that will make it so much easier for you to recruit the right level of staff and all of that. There's a home that's just recently told me that they've decided not to wear uniforms because that's but understand why that is, because other homes will say to you, well, if you don't wear uniforms, the residents can't, they can't actually see who the member of staff is because they don't remember it because they got dementia or whatever it might be. So I think it is all of that roundness, but understand the framework of social care. What is social care, or what is health and social care, and how to deliver it.
It's making sure it works in the real world, I guess. That's the
yeah, it is. And then of course there's the funding issue, that there is about, you're not going to, I remember when I bought I think it was my second home where we looked at a service that was quite poor, and that you've got X amount of time to turn it round by changing the name, all of that. These are the turnaround agents will tell you all of that goes on. But you've also got to realise that it's going to take you at least 2 years before you can look at any funds to reinvest. So it's about knowing just what that entails and how that would work. Because we don't always get what we think will be right. You know, we think, oh, we'll fill it up in 6 months because that's the need, and then you realise actually people you're filling it up with, you need more staff, and so it's all those bits that need to happen. So just be very, very aware. Great sector, and it's a growing sector. There's going to be more need for care, not less. It's what bit of it you want to sit in.
It's really valuable, thank you. And what's the best piece of advice that you've ever received personally?
I think it's about being true to myself, and that was from my mum.
Okay.
My mum said, whatever you do, just make sure you can live with it. So I think that was great. So you check decisions, you check what you're saying, you check what you're doing. So that, I think, is probably my kind of life motto. And if you you know, if it doesn't feel right, then it might not be right. So you know, all those kinds of really kind of things that really have influenced me in life in general. But I think sector-wise, I look at some of the people, you know, I think I learned so much from Sheila, who always kind of went forward and did what she felt was right. So I think that was great. But a piece of advice that probably has stuck with me is from a senior politician who is a very good friend of mine and sort of knew me many, many years ago. So we've known each other probably for 30 years. And he said to me that, you know, the path that you choose must be the path that you have a vision for. So it's no point, basically, going down the road and changing your mind. The vision that you have, you know, that you've lost vision, and I think that keeps you on a narrow, on the trajectory, if you like. So I chose to do this, having come away from what my kind of safety background is, even though I'm now back into it as a governor of a university. But I think I chose it, and then I thought I want to make a difference in education in that, and I was able to do that. But it was the vision that grows, and I think that's what he said to me, because if your vision keeps growing and you can see what lies ahead on an ongoing basis, then you'll always get to something. And I think that probably is the best piece of advice. I can't tell you who it was before you ask me.
No problem. Well, I mean, I think it's a great piece of advice, and I think I mean, we always advocate that people have a clear vision for where they want to be. I think it's having something really, really clearly defined. We call it carving your vision into stone. Gives you something to strive for, something really specific that you're looking to try and achieve. So, no, I think that's a fantastic piece of advice. So, Nadra Ahmed, it's been an absolute pleasure. Thank you so much for coming on the Care Home Show.
Thank you.